welcome to our open house. My name is Emma Melton, and I am the registered dental hygienist here at Thompson Family Dentistry. I'm so happy that you chose to attend my presentation today. Today we are going to spend the next 15 to 20 minutes learning ways to keep it fresh by learning how to brush and floss like a boss to improve our overall health. Before we get started, I would like for you to quickly introduce yourself. Let's start with you. Oh no, you look a little different than when I first came in here. What do y'all think?
Some better teeth. I've definitely seen better teeth.
What happened? I'm not sure, but I think it's your teeth.
I remember and
I can't understand you. I think your teeth fell out.
they did.
Let's see. Poor oral health can look bad, but it can also make it hard to understand you. What's your name?
My name is Amy.
Now, why don't you like teeth like that?
I don't like teeth like this because I just realized it's hard to talk, and if anybody knows me, they know I love to talk, so this would not work. Absolutely not.
Good point. All right, let's use these to introduce ourselves. Whenever we toss you above a teeth, introduce yourself and say why you would not want teeth like that, and then pass it along. We'll start with you. You don't have to worry. It's a souvenir.
Well, I smile a lot, so I wouldn't want anybody to see me.
Awesome, yeah. And what's your name?
Amelia.
Nice to meet you, Amelia.
Okay, so my name is David, and one reason why I wouldn't like to have teeth like this is I do youth outreach at my church, and I do speaking, and this would be a strange look.
Yeah, good point.
My name is Savannah, and I like white teeth, so I wouldn't have one.
I like white teeth too. That's a good point.
My name's Logan, and whenever I look at somebody, their smile's the first thing I normally see, so it's just an impression thing.
Yeah, I understand. Good job.
My name is Jonathan, and I wouldn't want teeth like these because it's just not cool to have teeth like this. Just makes it look bad.
Yep, I understand.
I'm Brianna, and I wouldn't want teeth like this because I'm always laughing and giggling, so
Yep.
that would not be a nice sight to see.
And I'm Sue, and this just would not go with my hair.
I know.
No, I wouldn't like those kind of teeth at all.
Yeah.
Your turn.
I'm Nick, and I'm with Sue, and I don't think I could use this because I have a parcel right now, and it keeps falling down,
See?
so this would fall down more, I think.
Yeah, good point.
I'm Robert, and I don't think I could use these to eat with.
I don't think so either. It'd be hard to
They
eat.
just don't look very healthy.
Yeah. All right. Well, nice to meet everyone. I think we can all agree that poor oral effects not only affects your teeth, but also affects your looks. Let's see. Now, it can also affect your health as well. All right. Good oral hygiene plays a key role in promoting good overall health. By maintaining good overall health, we can avoid many diseases by simply utilizing daily strategies into our routine to promote overall good health. Let's look at some facts. Poor oral health is damaging in many ways. Remember, a healthy mouth equals a healthy body. Now, we all do not want teeth that looks like that. Can we all agree?
Yeah.
In addition to tooth loss and gum disease, poor oral health can result in cardiovascular disease, which is heart disease, and kidney disease, and even complications during pregnancy. Remember, a healthy mouth equals a healthy body. When we let bacteria build up in our mouths, it can actually enter the bloodstream, and this can travel to our hearts. This can lead to life-threatening diseases such as atherosclerosis, which is the hardening of the arteries, and endocarditis, which is inflammation of the inner lining of our hearts. Both of these heart diseases can result in a heart attack and even lead to death. So remember, a healthy mouth equals a healthy heart. Another disease that can result from poor oral health is kidney disease. Periodontal disease resulting from poor oral hygiene can cause inflammation in many of the major organs, including the kidneys. When this occurs, the kidneys experience a reduction in function, which can lead to renal failure, and possibly even death. People with existing kidney diseases and diabetics must be especially careful in maintaining good overall health because they're a higher risk of getting the disease. So remember, to be kind to your kidneys by keeping your mouth clean. Is anyone in here pregnant? Okay.
We're about to say yes.
Sadly, poor oral hygiene in pregnant women can result in complications during pregnancy, including increased risk of premature births and underweight babies. So by just maintaining a healthy mouth during a pregnancy, a mother can actually increase her risk of delivering a healthy baby. So if you won't do it for yourself, do it for your baby. These are just a few of the many diseases poor oral hygiene causes. It's really scary if you think about it. But I have good news. There are simple preventative measures we can take to avoid these diseases. First, make sure you visit your dentist every 6 months. Even if you're not having any issues, even if nothing's hurting you, early diagnosis is the best way to increase your chances of recovery. Second is to maintain a healthy diet by choosing nutritious food and avoiding foods that are high in sugar. If you just have to have that sweet, make sure you're either brushing or flossing after, which is ideal, but I know that's hard. So if we can at least swish with water after or use Listerine, that will help. And another way to avoid diseases is to stop smoking. In addition to cancers of the mouth, nicotine from cigarette smoke can cause yellow, brown, and black staining on the teeth, and nobody wants ugly teeth. There are also some strategies we can use on a daily basis to promote a healthy mouth, starting with daily brushing. All right, stand up if you have brushed your teeth today. That's really good. All right, y'all can sit down now. Now, I was gonna ask for people to stand up if they haven't brushed their teeth, but that's actually really good that everyone stood up. So I was hoping that everyone would, and on behalf of me and the person next to you, we thank you for not having bad breath. All right, so now stand up if you plan on brushing your teeth tonight or even after lunch. That's good. All right, you can have a seat. The truth is, most people only brush their teeth once a day, which is better than not brushing at all, but for optimum oral health, we would like to brush our teeth before going to bed to remove all the bacteria from the day from our teeth. It is also important to use a good toothbrush. A soft bristled toothbrush is preferred to remove debris without harming tooth enamel. If you use a hard or medium toothbrush, it actually can remove some of the enamel from your teeth. And the soft bristled toothbrush is the only toothbrush that the ADA recognizes. So definitely want to have a soft toothbrush. Once we have a good toothbrush, we want to make sure we are using correct angulation to cover all the surfaces of every tooth. Let's demonstrate. So you want to make sure you're at a 90-degree angle, getting right into the gum line. You're making sure that you're doing small circular motions on every tooth, the cheek side, the tongue side, even the front teeth, every tooth, and you want to make sure that you're applying the correct pressure, because if you're actually brushing too hard, it can actually remove some of your gums, and we don't want that to happen. And also get the chewing surface, every surface of the teeth. Would anyone like to try? Come on up. All right.
So you take it like this, like touch it like that.
Maybe not so hard. Lighten up a little bit, and you're gonna want to make sure you're angling it right there. Yep, a 90-degree angle and circular motions. And you do all the teeth, the chewing surface, the front, the back, all that good stuff. Perfect. Good job. All right. Thank you. All right. Moving on. Equally as important as brushing is flossing. Many people assume that brushing alone is all that they need to have a healthy smile, but it simply is not true. As you saw with the brushing demonstration, a toothbrush simply cannot get in between the teeth, which is actually where most of the bacteria lives. Therefore, we must floss like a boss daily to truly be healthy. To correctly floss like a boss, it should be about 12 inches like so. You don't have to exactly measure it, but want to get about this length. You're going to wrap it around your middle finger. Middle finger is preferred because it's easier with dexterity. You are going to make a C shape around each tooth. It's really important to use this C-shaped technique because you're actually getting around the whole tooth. So what you do is you're going to go in between the teeth and C-shape it around the tooth and go up and down a few times, and then you're actually going to switch it to the other tooth and up and down 3 times. And don't jam it in. You want to be gentle. Don't make yourself bleed. And also when you're popping it out, don't pop it. Go very slow. And you're going to do that to every tooth, top and bottom, and you can actually even do it between the back tooth. Even though it doesn't have a partner, food can actually still get back there. You're going to do the front teeth as well. Be sure to really angle that C shape around each tooth. And if you do have, you know, a bridge or a lingual retainer with braces, they actually make tools to where you can insert this easily. So, would anyone like to try? All right, come on up.
So do I have to use my middle finger or?
Yes, it's easier for dexterity.
Okay.
And remember, when you are flossing in between the teeth, you are going to want to re-wrap your floss because you don't want to re-put the bacteria back in between the teeth.
Okay. 1, 2, 3. Okay.
Good
And then
job.
you kind of do the C shape after it gets in there, I guess?
Yep, you're going to do the C shape. Be sure to make that C shape. Perfect. Yep, good job.
Thank you.
All right, and if anyone else has any questions about flossing or wants to practice, I'll be more than happy to stay up here and answer any questions that you have after the presentation. All right, so let's review. Now we know that poor oral hygiene can lead to poor overall health and diseases. We also learned easy preventative measures to incorporate in our daily routine to promote overall good health, such as brushing and flossing. What letter shape do we like for flossing?
C.
Good job. All right. Does anyone have any questions?
How are x-rays needed whenever you go to the dentist?
So what we want to do is typically we recommend them every year. Now, typically that's on a person that doesn't build up a lot. Now, if you are susceptible to cavities, then we would like to take them every 6 months because on the x-rays, it actually shows us where the cavity is. You might not be able to see it in your mouth, but we can see it on the x-ray.
I have a question. Okay, are you supposed to floss every single time after you brush your teeth?
Yes.
Okay,
So it
twice
is.
a day as well.
Yep, it's ideal. If you can do it, obviously twice a day is best, but at least do it once a day. You'll be good. Good question.
So I use those picks for flossing.
Mhm.
Are those good to use too?
They are good if that's the only way you're gonna floss. So it's better to use that than nothing. But we do prefer regular floss because you are able to get that C shape around the tooth easier. With the picks, it's just kind of straight, so you can't really angle it that well. But if you're not gonna do anything, that's always the best. Good job.
How will I know if I have a cavity?
So sometimes the telltale signs are hurting, sensitive to hot, cold, pressure, sweets. Even if you open your mouth, you might see a black hole. That's kind of the big signs. But sometimes they can actually, you don't even know you have them unless we do the x-rays, or you are coming to your dentist every 6 months so we can diagnose. So early detection is the best way for recovery. Good job. Any other questions? All right, those are all great questions. All right, this completes my presentation. Before you leave, I want to thank you again for coming and ask that you please take a moment to fill out the evaluation forms on your table. This is very helpful in letting me know how I'm doing. And if you bring me a completed form, you will get a pretty cool goodie bag. It has a toothbrush, which is soft, has some good toothpaste. Personally, I like Colgate, they are my favorite. And it does have some flossing. Be sure you are doing your C-shaped flossing. So all of these in this goodie bag will help you floss like a boss to improve your overall health. Thank you.